Assalamu alaikum and welcome to the episode of Peer Project web series. Just to people who have joined us for the first time, let me give you a brief introduction. This is a research-based web series to discuss the model of community women volunteers implemented in Nishtar town, Lahore. Our research study was aimed at testing the effectiveness of community women volunteers in enhancing the utilization of LHWs provided FP and RH services by married adolescent girls and young women aged 15 to 25 years. Nur Center is responsible for this research and is also the one who's organized this web series. Nur Center for Research and Policies, endowed by Nur Foundation based in Lahore, Pakistan, and is the technical research arm of Nur Fatma Memorial Systems. NCRP, as we know it, has multifaceted projects and programs to generate, collate, and disseminate evidence for strengthening policy making and planning, as well as reforming practice in the sector of health, education, and integrated community development. The intervention testing study was curtailed by the COVID-19 pandemic. We had, however, completed the baseline survey of the study, and the community women volunteers had been recruited by the participating LHWs of the study to work with them. In today's episode, we will be focusing on the role of counseling with reference to reproductive health and rights of married adolescent girls and young women. And we are very fortunate to have with us Dr. Sadiah Ahsan Paul. Dr. Sadia is currently consultant at Orthopedic and Medical Institute Hospital. She works in the advisory capacity as a trainer for several national and international organizations. She has been associated with the concept of fertility centers since 2007 and herself is a fertility specialist. She's a gynecologist by profession and obstetrician and fertility consultant. She graduated from Dow Medical College, Karachi in 1987, is a member and fellow of College of Ops and Gynae. In the UK, she is the member of Representative Committee for Pakistan. And a lot more, because it will take me all the time to describe our Vedica's achievements. So I'm going to welcome her, and with us are Humna. Humna is here. She has been a part of the research that was conducted by Nur. So thank you very much, Dr. Sadia, for joining us. Let me dive straight into the heart of the issue here. What are, like, when we tried and talked to the adolescent young girl, we find them clueless. We find them clueless on many things, and especially when it comes to sexual reproductive health and rights. So for their knowledge and for my knowledge as well, although I've passed the age, but still, what are the basic sexual reproductive health rights of young adolescent girls? If you can just briefly.
Okay, Nabila, I think all the human rights which apply to adults and all of us apply to young adolescent girls as well. So it's basically the right to health and to, sexual health as well as reproductive health. These are all basic human rights, which, and the right to information. I think in the Pakistani context, we have all been deprived of any form of sex education, whether it was in school or whether it was, in at our homes even. It's like indirectly you hear from other people, and right or wrong. And then, we grew up in the age without internet, and cell phones. So now it's a different generation. They can seek information through their phones at the touch of a button. But it needs to be proper and organized. So the lack of sex education in a proper way in Pakistan is lacking, and that is leading to a lot of our issues. And the lack of general education, both for girls and boys, that is leading to a lot of our problems as well. So this would be my sum of our lack of the sexual and reproductive rights which exist here.
Right, Dr. Absolutely well put. But the issue here that we would like to focus on is that we over here, girls get married very young, and they are thrown
Yes.
at the deep end. Within a year, they become mothers. And what if, do they have information at that time that if they don't want to immediately go into forming a family,
Hmm.
what is it that they're required to do? Do they have access to commodities? Do they have information about the family planning and reproductive aspect of the SRHR?
Nabila, the reality is the answer is generally no. If a few of them have it, which may be true, if the mother is an enlightened woman who would do that or take her to a doctor before marriage so that she gets counseling, which is very rare and only in the people who are let's say the richer empowered people, but the majority of the public doesn't have this access. And with the result that not only do they have underage marriage, which is rampant in our society, these are children who get married with no education, general education, as well as education about their own body parts. Some of them don't even know what their reproductive organs are. So then family planning, of course, they have no clue. So we have our NGOs and some government programs as well, which are working, but in the majority of cases, are children and women, adolescents who, I mean, this is the group which we really should be approaching and educating because they're the ones who are not empowered and often forced into marriage and without any knowledge of family planning and contraception.
And mostly they're married to unknown men, they're arranged marriages. So there
Yes,
is no comfort there that they can talk to their spouse and discuss these things beforehand. So I believe that that heightens the importance of counseling in our circumstances. So,
absolutely.
right. So, all the government programs that are there, are you aware of any programs that are specifically designed for the needs of young adolescent married girls, specifically addressing the SRHR needs?
Nabila, I know that the Sindh government is very actively pursuing it, and I've heard about the Balochistan government also. And they've recently introduced this in schools as life skills education. So the teachers are being trained, and I know that Ahang, the NGO, which has a very nice curriculum as well, and a website with ready information that they have been part of, at least in Sindh. But I'm not aware about the other provinces as to how effective this is. Generally, I think this service is very lacking in Pakistan, and we do need, first of all, we need the counseling of the parents that this is required, then counseling of the teachers, because these are very sensitive matters. When these have been introduced in some private schools, especially, and I know of Punjab, including Sindh, that some parents have come and picketed outside those schools and said, "Ji fahashi sikhai ja rahi hai," there's obscene content, and even biology chapters from textbooks have been, the reproductive system chapter have been they've been banned from from teaching them. So that is ridiculous, you know. uh, so this happens. So we need to, parents need education, the teachers need to be educated, and this concept that, gee, this is against Islam is totally false, because Islam actually, if you read the Quran with its meaning, it advocates sex education. Sex is openly discussed in the Quran, and the Quran is meant to be read by children of a very young age as well as adults. There's no age limit or barrier to the Quran. So this is something which is openly there as an instruction book for life. So when our religion is discussing it, why can't we discuss it properly? Why can't we, even doctors, discuss it? So even doctors don't have proper training on counseling, which is very, very lacking in our society. You know, the right words have to be used, in a very sensitive way, in a culturally appropriate way, and they have to be given the right information. We don't want them going on porn sites and getting the wrong idea and becoming, you know, trapped into, we know how bad things can get. And this is happening in our society.
Absolutely. Dr. Let's talk a bit about the role of LHWs. They were supposed to, if my information is correct, originally 25% of their role was, their job was to take family planning information door to door to counsel young people as well as other women
Yeah.
and families, so they
Yeah.
can take up, know about the commodities, know about the family planning provisions, and also provide services as far as the pills and the condoms go. Now, in our research and everywhere else, we found out, and tell us about your experience in the area, that when they go to these houses, they are denied access to young people, especially young girls. Young girls, the family believes if they're unmarried, about to be married in a day or two, the family feels the need to somehow keep them away from this information. Have you had the similar experience?
Yes, it's true, but you know, I'm dealing with mostly educated women in Karachi, and generally, even amongst them, often these young girls, if they even come before marriage for counseling or advice about contraception, they don't want this happening in front of their mothers, whoever they've come with. So they want confidentiality so that they can speak openly. So I do feel that the LHW program, as it was meant to be, can really help. And not only should they be counseling, I feel they should be providing the required contraceptives as well, because remember, these contraceptives are also available over the counter. And in Pakistan, at least, the anyone can go and buy condoms, anyone can go and buy contraceptive pills. So giving them the right information or the right guidance, even, fertile period, the non-medicated methods of contraception, like avoiding sex during the fertile period, etc., etc. At least that information should be given. They should know about their bodies, how to protect themselves, not just about pregnancy, but against infections as well.
Acha, I just want to know, want you to give us a very brief introduction of the model that NCRP has developed to reach out young adolescent girls. Just very briefly, main features of the model.
Ji. So, Nabila, we asked LHWs to attach these community women volunteers with them. They were supposed to pick anyone from their community, कोई भी उनकी surrounding में जिसके साथ भी उनका अच्छा relationship है, उनके friend circle में से, उनकी family में से. हमने उनको बोला कि आप अपने साथ ये केडर इंट्रोड्यूस करें एंड ये केडर फिर आगे जो हमारा टारगेट ग्रुप है मैरिड एडोलेसेंट गर्ल एंड यंग वुमेन का एज ग्रुप जो हमारा था 15 to 24 उनको आगे इन्होंने फैमिली प्लानिंग के एंड रिप्रोडक्टिव हेल्थ के मुतालिक मैसेजेस देने थे कोई बहुत ज़्यादा हमने इनको इस तरह का करिकुलम नहीं दिया LHW अपने हिसाब से जिस तरह से भी उनको ज़रूरत होती थी वो इनको अपने साथ अटैच करती थी और फिर ये आगे उनको मैसेजेस देती थी यंग वुमेन को और मैसेजेस भी बहुत सिंपल थे कि भाई अपनी सेहत का ख्याल रखो वक्फा करो और ये कि आपकी कम्युनिटी में आपको सर्विसेज प्रोवाइड करने के लिए लेडी हेल्थ वर्कर है उसके पास जाओ और उसकी काउंसलिंग उससे काउंसलिंग लो तो ये हमारा सिंपल मॉडल था जो हमने इम्प्लीमेंट किया अपने प्रोजेक्ट के थ्रू
Dr. Sab, my question to you, you've heard Humna, this model, and they weren't able to finish the entire work that they had planned to do, but they still have enough information to know that this works. Now, the model briefly is that because LHWs could not access this segment of the society, young, adolescent, married girls, so from within the communities, they encouraged women volunteers to join the force and help with the access and become that channel of communication between LHW and the young girls. Do you want, I would like your comment on this model, and do you think it is a good idea or will it work?
I think it's an excellent idea because you see, you need to gain confidence. If you're going into somebody's house, the people you're entering and you just start talking about these very sensitive issues, they may not trust you, they may not like you. But if somebody trusted and respected from the community is going with them, it gives them that confidence and it gives them that it's like having a certificate that look, this is a reliable person and what she's saying is good for you. And having a young person with you as well as a volunteer, you see, you're that if you're staying in that household for an hour, I think that hour with multiple people listening to you, your reach is enhanced. So I think it's a very good model, and my suggestion would be to add services, link it to services as well. So if they're giving them that information, that, okay, very good counseling, tell them about menstruation, about hygiene, about, the natural family planning methods and preventing infection, safe sex, etc., etc. Then link them to the right person or the right health facility or the right doctor. And we have telehealth now. COVID, although it didn't help with your completion of your project, it seems, which is a shame. But then we have a mushroom of very good telehealth services on sexual and reproductive health, including one that I've been involved with, and that deals with the whole range of reproductive health matters, contraception, post-abortion care, etc., etc. And they will guide these women all over Pakistan to the right facility. So troubleshooting. So I think it's an excellent model that you have developed and it's workable.
Thank you, Roxab. What other issues do these young girls face at their age? Now that we have you, you are a renowned gynecologist. What should they be sort of aware of? Suppose I'm a 16-year-old, because we are in Punjab, and in Punjab, 16 years old are allowed to marry, and I get married. How do I protect my body and save myself, even if I'm forced, not even forced, if I just get married at 16? So what will be the tips you'll give to our audience?
I'm giving tips to the client, or am I giving tips to the say your LHVs, who am I
No, no,
giving
to the
tips to?
directly, to the clients directly. Let's start with the end users. How can they, what can they do?
Look, supposing if this girl is fortunate enough to come to a health facility and to a doctor or a nurse or a healthcare provider, then of course, we should give her the whole range of knowledge about her, not just about protection and rights, but about how to prevent a pregnancy as well. Because, I mentioned about sex education, but also this concept of forced marriage and early marriage is also not in the spirit of our religion. The nikah is about marriage between two consenting adults. It has to be by choice and it cannot be forced. That's why they're asked 3 times. And they have the right of divorce, which is on the nikanama, which is crossed off by the by your own parents, actually the girl's parents, or because they don't want a divorce, they want a forced marriage. And even my nikanama has my right of divorce crossed off. So it's an emotional, I didn't know it, but it's an emotional time, and you just sign it, okay, and you are asked 3 times, do you want to marry this boy, and you just say yes, 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 and no matter what, and the boy does the same. Okay, so it's only recently in med school that I found out that this is the case. But majority of a girl of 16 will not know. She does not know legally or even by religion, reading the Quran in Arabic. They know nothing. So they may be educated in school, have can read or write English, Urdu, whatever, but still be jahil about their rights. So if the girl is fortunate enough to come, then we have to give them all the choices that look, you can do this, and it is imperative that she avoids pregnancy at least till she's in her, say, mid-20s at least, for the best outcome, both for her health and for the pregnancy. So it's very, very important. Maybe she's studying in college or school, and getting pregnant would just destroy her chances of completing her education or a degree or getting a job. Uh, and let's face it, the boy that she's marrying is also either very young and jobless, and or he's an old man who's into marrying young girls with 3 or 4 wives. Let's not forget polygamy in Pakistan. So these poor girls who are being used like cattle a lot of times, not all, but yeah, a lot of times. Uh, if she manages to come in contact with a healthcare provider, we should do our best. Tell her about condoms, tell her about contraceptive pills. And these are methods which are within their own control, you know. But the problem is there are so many myths and misconceptions about virtually every family planning method. So the counseling has to be of very high standard, and all their questions need to be answered. Even doctors are not aware that hormonal contraceptives prolong the life of the woman. She is healthier. Women who have been on the pill or any hormonal contraceptive live longer. They're less likely to have cancer. They're less likely to have heart disease. And but we hear the contrary from the public. Uh, and this is not something new. This is not something I'm saying. This is evidence based. Similarly, the best contraceptive methods like intrauterine device, we have again myths and misconceptions about that. But anyway, for these young adolescent girls, the appropriate method would be either putting her on the contraceptive pill, or as well as, I tell my patients or my clients that, look, even if you're taking the pill, you should still use the condoms, because you don't know where your husband, or he may have other girlfriends, and especially if he has multiple wives. So you need to protect yourself. So this is the reality, and unfortunately.
Also, Dr. In the current time of media, especially the social media, the internet is common. Wherever it's common, it can be misused. There is tons of information on the internet. I believe, and I would like you to comment on it, that our young generation, our adolescent children, also need counseling to understand all the material that they come across when they are surfing the net. So how
Yes.
would you comment about that? Because there's a lot of misinformation, there is a lot of commercial stuff over there.
That's right. So directing them to the right website is also very important. Like I said, even our masis have cell phones these days, and some of them have smartphones as well. So they're very well connected. And these young people, those who have laptops and these tablets, etc. So one of the good websites that I'm familiar with is the Ahang website for adolescent and sexual health information. I think it's very good. And similarly, there are many other organizations which have helplines as well as websites where in Urdu as well. So one needs to have a list, and I think perhaps you could help with that and tabulate a list for these LHVs who are going for counseling, and provide it to even providers like us, that we can direct them to the right websites. Now, uh, uh, during COVID, we've learned how to speak to each other through Zoom and have webinars, etc. And similarly, I've done interviews for young people where these kind of questions were asked. And I feel we should do this in maybe record them and have a dedicated website in Urdu where health experts are giving advice on various contraceptive methods and these taboo sort of sexual health related matters which nobody talks about.
True.
One of the things which I learned, which have worked in India as well, is these WhatsApp little 2 or 3 minute videos, which their LHVs used when they visit, their clients, and they do the counseling, and then on their own phone they show them this video, the client. They say, "Oh, देखो ये डॉक्टर साहब ये बोल रही हैं." Okay, hear this, it's not just me. So if it's a doctor who is renowned in your country or in that area, or maybe that village of Punjab, if she's saying that in Punjabi or in Urdu or in any regional language, that tends to make it more greater impact, let's say. So these little clips of real doctors, somehow our public listens to doctors more than nurses or LHVs. They tend to, this is our psyche, unfortunately. Uh, but this matter of trust or whatever, if it's a famous doctor or a doctor who is well respected, this is known that it helps in decision making. This helped to us in our PPIUCD project as well, where we found that we have counselors doing the counseling for family planning, and they found that the uptake of IUCDs was highest when a doctor did the counseling. So nearly 90% would agree to have that particular method, you know while with the nurses or the midwives, it was nearly half that number. So this is the psyche, I'm afraid. But a little 1 minute video can change the mindset.
I totally agree with you, Dr. Sab, and I totally agree with you. We do trust doctors more than we trust anybody else, but doctors don't have time to satisfy our
Yes.
questions. And this might just work, the video, and in which the
Yes.
doctor is saying things, it will be more credible and reliable. Do you have, like, if we compare our country to a developed country, why are their youth, from where we are watching them, they seem more empowered? And what is the role of counselor in giving them that confidence and empowerment?
Um, Nabila, I think it would be unfair to compare us to the developed Western countries. First of all, they are, education is key. So if the mothers are educated, then everything changes. The father, of course, and then if you have sex education in school, um, it automatically gives them confidence. Children, from the age of 5 or 6, are taught about their bodies, how babies are born, and not to talk to strangers. And if you talk to strangers, don't accept sweets, etc., etc. You see these notices outside schools, and children learn to protect themselves against all kinds of abuse, and that is the first step. And be honest with your child. When a child asks you questions about anything, uh, and matters of sex and childbirth, etc., and it's all very nice to say, gee, a penguin dropped you from the sky. We have
Yes,
these kind of stories as well, that how the
yes,
little baby was born. It's never a vaginal birth, it's always a C-section. Your mommy's tummy was cut open and baby came out like that. But you see, the child also loses trust when you lie to your child. uh, you should just say it as it is, in a very matter of fact way, and the child trusts the parents then. And when the parents don't do that, they seek information elsewhere, and that's where they lose confidence as well. So in our society, the difference I've seen, between having lived in the Western society as well, is they treat children almost with the same respect as adults, and they will try to honestly answer that child's query in whatever simple way or whatever way. uh, but over here, if a child asks too many questions, even in school, in class, an intelligent kid is looked down upon. The teacher shuts them up, and they don't like being questioned. So it's our culture of not being questioned, and that
true.
leads to lack of confidence. And reporting problems is also, there are educated girls who get married, and no matter what age, whether 16 or 26 or 36, they may be going through abuse in their marriage or not having sex at all, but they don't know any better, and they're too shy to complain about it or report
True.
it to anybody.
True. Doctor, would you agree that, especially in our circumstances, in a country like Pakistan, where a lot of these things which the West has adopted as a way of life is still a taboo? In these circumstances, the role of a counselor become very important, and access to this vulnerable group has to be enhanced. And in this case, this model in which the very neighbor is recruited to reach out can actually work wonders, and hopefully get the right information at the right point to the most vulnerable client that we might have out there. Would
I
you
think
agree?
yes, I agree with you. I think it's an excellent idea. I'm sure these neighbors or volunteers or respected member of the community, they themselves go through some kind of training, and information is given to them
They
for the
do.
counseling.
Yes.
So they're actually they're educating the whole community actually by doing that. So I think it's an excellent model which can work for us. and help change the mindset of parents as well, that this is nothing wrong, this is not fahashi, this is something which is very needed. And even parents have difficulty talking to their children, giving them the right information. So coming from a third person, from an auntie or whoever neighbor, the right information is very, very crucial and helpful, I
Right.
think.
Right. Noor Foundation is recommending that IR MNCH program may consider institutionalizing and mobilizing this community women volunteers within the LHW program to
Mhm.
promote access and service to these for access to information and services to these
Mhm.
young girls.
Yeah.
uh, what would you say to the IRMNCH, especially in Punjab?
I think it's a good idea, and I think they should go ahead with it. And in fact, this sort of thing should be introduced into nursing schools and medical colleges as well, because counseling skills are very lacking in amongst doctors. As you said, doctors don't talk much; they don't have time.
Yeah,
But we can use them for this purpose. Record short videos of their messages about
true.
key messages, and they can be used. And we did this for COVID, and please remember that doctors are also very shy of coming in front of the camera and speaking. Like, most doctors don't want to do this. And we forced, when COVID started, we forced senior gynecologists from all over Pakistan to make short video clips on their cell phones, and we shared it on Facebook and social media. And the feedback we got was, and that spread like anything, because a lot of people even now don't take COVID seriously. And they said, oh, because so and so doctor was saying this, we believed it, that it is actually happening. So we can do the same for contraception, and I'm very sure this will work, you know and if because human attention span is very, very narrow. And if
Absolutely.
yeah, so that has to be done effectively.
Absolutely. And maybe, more models like this can be developed so we
Mm,
can access the community through the community itself.
yes.
More research is needed so we have data to work with,
Mm,
proper data to work with. Uh, Doctor, we cannot assume that counseling will actually result in increase in CPR.
mm.
What else do we need to do to ensure that there is a higher uptake of contraceptive and more widespread family planning among the people of Pakistan?
Nabila, I really believe in trickling down services right to the grassroots, and I do believe we need to empower our nurses, our LHVs, and midwives. If they can counsel, they can prescribe as well. I really, I mean, if they have a check, they're given a checklist that look, these conditions you will not give, say, a combined contraceptive pill. That's good enough. But if they've gone through a checklist, and this girl chooses, this 16-year-old girl who's getting married next week, and she gives her the right information, yet this girl cannot get the services, then it's cruel. I think it's criminal in a way. So they have to be linked to the method of choice that these girls choose after counseling. Only then will we reduce the CPR. Otherwise, this is just a wasted exercise. Until we provide the services, it's not good enough saying that, oh, I think, okay, so you've chosen the combined pill, and that will be fine. And she explains to her how to take it. But if she can't get the pill, you know,
Then what's the point?
then what's the point? She goes to a RH center, which closes at 2 p.m., the Jinnah Hospital or the civil hospital, which is everywhere in Pakistan. And 2 baje wo band ho jata hai. Then there's nobody to take her there. after, and then she can't afford to go to a private practitioner. There's no transport available. So if this LHV has gone to her house, she must have the products as well. We need to trust them. We need to train them properly. And it seems like you've done it. If they can counsel, because counseling is the most difficult bit, believe me. Prescription is the easiest bit कि आपने लिख के दे दिया, but आपने समझाया नहीं. If you haven't explained to them that, oh, if you miss a pill, or if you get diarrhea, or if you've taken antibiotics, you need to take added protection, and how, the whole thing needs to be explained. If they can, and there's no big deal about it,
Yeah.
that is what needs to be done. Not, and the services that she cannot provide, she needs to ensure that this girl gets to that particular center. There's so many NGOs working and doing excellent work in Pakistan. And I would love to look at your website. It sounds like a great place where they can get information as well. So directing them to the right services, I think that's crucial.
True. Also, the baseline tells us that 2 out of 3 girls that they, reached out to during this project, they had no clue about family planning, have never heard of it.
I'm not surprised at all. I'm surprised that even the 1 out of 3 knew.
So was I, actually, to be honest with you, so was I. But what you're saying is very important. We have to give them the right information at the right time. And I think the government needs to look at all the research work that is being done and pick up things. Now, the amazing part of this model is that it is, it's these women volunteers are, they didn't charge anything. They were free. They provided free services. So there's no added cost to the program if this is adopted. Humna, would you like to comment on this? If I'm saying anything wrong about your project, I just wanted you to, because I talked about the sustainability element of it. So this is because it has very little cost attached to it, and the women volunteers are actually have volunteered for free to help out the LHWs. So am I right in saying that? And also, how do you, what did you work on the sustainability aspect of it, and is it a sustainable model?
जी नबीला, जो प्रोजेक्ट में सस्टेनेबिलिटी जो थी वो शुरू से ही देखी गई थी. जो वॉलंटियर्स थी वो फ्री ऑफ कॉस्ट उन्होंने काम किया, और शुरू में बहुत एप्रीहेंशंस थे LHWs के कि ये वॉलंटियर्स हमारे साथ क्यों काम करेंगी, ये इनको हम क्यों अटैच करें, हम इनको कुछ पे नहीं करें तो ये किस तरह से काम करेंगी. बट हमने अपने ओरिएंटेशन सेशंस में और डिफरेंट जगह पर फिर उनको यही बात समझाई कि इन्होंने कुछ एक्स्ट्रा काम नहीं करना. जो हमारी कम्युनिटी वुमेन वॉलंटियर्स हैं, इन्होंने कहीं LHWs की तरह डोर टू डोर नहीं जाना. इन्होंने जहाँ पर भी इनको हमारी यंग मैरिड एडोलेसेंट गर्ल्स मिलती हैं, कहीं पर किसी शादी में, किसी भी फ्यूनरल में, कहीं पर भी कोई सोशल गैदरिंग्स में जहाँ मिलती हैं, जहाँ इन्होंने बैठ के उनको जाना है. और हमारा जो उनका कम्युनिटी वुमेन वॉलंटियर्स की जो एज रेंज थी वो भी काफ़ी वेरी थी. 16 to 49 तक हमारे पास एज रेंज. तो ये सब जो कम्युनिटी वुमेन वॉलंटियर्स थी, इन्होंने सिर्फ बैठ के उनको मैसेजेस देने थे. और जो दूसरा सस्टेनेबिलिटी का एस्पेक्ट था वो यही था कि अगर कोई वॉलंटियर एक सर्टेन पीरियड के बाद नहीं LHW के साथ काम करना चाहती, बिकॉज दे यूज्ड टू रिपोर्ट देम. फिर LHW उनसे मिलके पूछती थी कि भाई आपकी मीटिंग हुई, आपने उनसे मिली है, वो अपने यंग मैरिड वुमेन से, उनसे आपका इंटरेक्शन कैसा रहा. तो अगर वो उस चीज से भी परेशान हो जाती थी, आगे काम नहीं करना चाहती थी, तो कोई मसला नहीं था. LHW उस पीरियड के बाद से एक और वॉलंटियर अपने साथ अटैच कर लेती थी. इस तरह जो मैसेज था वो, उसकी सैचुरेशन बहुत ज़्यादा थी. और यही जो सस्टेनेबिलिटी थी उसका पॉइंट यही था कि ये फ्री ऑफ कॉस्ट काम करी थी. तो इनिशियली तो था प्रॉब्लम, बट उसके बाद से दे वर फाइन. और इसीलिए, और फिर काफ़ी जगह पर हमें ये कहा गया कि नहीं, आप इनको पैसे दे दें, अगर आप पैसे देंगी तो ये और भी ज़्यादा आराम से काम कर लेंगी, क्योंकि आप लोग तो काम कर रहे हो, आपको प्रोजेक्ट है, फंडिंग मिली हुई है. बट वी जस्ट लाइक LHWs का ये पॉइंट ऑफ व्यू था. बट हमने इनको एक्सप्लेन किया कि भाई वॉलंटियर्स होती ही वो हैं जो फ्री ऑफ कॉस्ट काम करती हैं, और इन्होंने कुछ एक्स्ट्रा करना नहीं है. So that was all.
I am a very suspicious person by nature. मुझे ये बताएं कि खवातीन हमारे यहाँ कहते हैं औरत से पूछो कि आप क्या करती हैं तो वो कहती है मैं कुछ नहीं करती, बट दैट डजंट मीन कि वो कुछ नहीं करती हैं। वो घर में सुबह सबसे पहले उठ के और एंड में सबसे आखिर में सोती हैं और सारा दिन काम कर रही होती हैं। तो हाउ कम दे विल बी विलिंग टू वर्क फॉर फ्री? क्या आपको कोई वजूहात उन्होंने बताई कि औरतों ने क्यों कहा कि चलो हम कर लेते हैं ये काम, हमें कुछ भी नहीं दे लेकिन फिर भी हम कर लेते हैं?
जी जी, नबीला, जो वॉलंटियर्स थी ये वही खवातीन थी जिनको LHW जानती थी और कम्युनिटी से ही खवातीन थी। तो बहुत से हमारे पास इस तरह के रीजंस आए, जैसे कोई कहती थी कि भाई मैं फ्री हूँ, बच्चों को स्कूल भेजकर मेरे पास टाइम होता है तो मैं आराम से बैठ के कोई भी मेरे आसपास है मैं उनको समझा सकती हूँ। इसके अलावा ये था कि और जो रीजन थे उसके अलावा यही चीज सामने आई थी कि ये लोग जो थे फ्री ऑफ कॉस्ट इसलिए भी काम कर लेते थे कि
I think we have talked about this, and in Pakistan, nobody should question the importance of counseling. Dr. Sadia has very rightly put that we need to include this in the trainings of nurses, even doctors, because they don't have that, especially LHWs. And if we are going to have this volunteers, women volunteers cater, then they also need to be properly trained, because counseling is not an easy job. It's a make and break of a program. अगर आप काउंसलिंग ठीक करते हैं तो आपका प्रोजेक्ट सक्सेसफुल होगा, आपके जो स्टैटिस्टिक्स हैं आपके मुल्क के वो बेहतर होंगे, आपके मुल्क के बच्चियों की सेहत बेहतर होगी। लेकिन अगर आप काउंसलिंग ठीक नहीं कर रहे तो उसका नेगेटिव इम्पैक्ट भी हो सकता है। इसकी काउंसलिंग की इम्पोर्टेंस को अंडरमाइन नहीं करना, और हमें जितने भी वॉलंटियर मिल सके, आई थिंक ये मॉडल भी अडॉप्ट करना चाहिए और इसके अलावा भी एक्सप्लोर करना चाहिए कि और क्या तरीके हैं कि हम अपनी कम्युनिटी के बीच में से ही लोगों को निकालें और उनको हम ट्रेन करें और उनको हम अपने इस मिशन में अपने साथ शामिल करें। Dr. Saab, I will just ask you if you have any last comments, and then we'll close our program for today.
हाँ, बस मेरे कमेंट्स यही है कि ये बहुत ही अच्छा आइडिया है और बहुत अच्छा काम आपने किया है, क्योंकि ये जो आपने रिसर्च की है, would you prefer I speak in English or Urdu, Nabila?
I don't know. I think it has to be a mix, whichever you feel like.
अच्छा, ओके, बिकॉज आई फील कि इस तरह की रिसर्च इससे मुझे भी नई नई बातें पता चली जो मैंने आपका वेबिनार अटेंड किया, एंड दिस में रियली बी द आंसर टू आवर प्रॉब्लम, बिकॉज इसमें आप कम्युनिटी वालों को जो वॉलंटियर्स को जो शामिल कर रहे हैं, although I must say I'm really surprised at these volunteer women, इसलिए कि अगर मैं भी अगर हाउसवाइफ होती तो बहुत मुश्किल होता मैं वॉलंटियर करती, बिकॉज लाइक यू सेड हाउसवाइफ जो है सुबह से बिस्तर में जाने तक काम ही कर रही होती हैं, तो मे बी it's an excuse to get out of the house for these women, and that's why they like doing it. Otherwise, uh, and I think it would be nice to pay them, even if it's a small token. I think that would be great. But yeah, I think it's a great thing you've done, and we need to, I will say again, link it to services. And
thank you very much, Dr. Thank you very much. I will leave the payment out for now, because हमारे लिए, क्योंकि हम अपने गवर्नमेंट को अगर कोई बहुत कॉस्ट हैवी प्रोजेक्ट बना के देंगे तो वो इस वक्त इस पोजीशन में नहीं है, वो हो नहीं पाएगा। तो इसलिए औरतों के लिए जो इसका एक साइड इम्पैक्ट है जो मुझे नजर आ रहा है, जो शायद इन्होंने एक्सप्लोर भी नहीं किया, वो ये है कि ब्रेक्स देयर आइसोलेशन। उनको बहाना मिलता है, वो घर से बाहर जाती हैं, और जब ग्रुप फॉर्म में आप इकट्ठे होते हैं, साथ वालों से आपने कोई तो अच्छी बात की, कोई उनको समझाया कुछ, आपकी एक स्ट्रेंथ भी बन जाती है। और जितने और मसाइल है खवातीन के, ये उनको भी हैंडल करने का, उनको भी एड्रेस करने का एक बहाना बन सकता है। So with that, I thank you very much, Dr. Saab, for taking time out, and please watch out for our other episodes. we will be exploring various aspects of peer project during our web series. Thank you very much.
Thank you.
Thank you so much, ma'am. Thank you.